I wanted to quickly discuss another topic that will be on your upcoming quiz. And we'll talk about first ischemic heart disease, starting with risk factors. And it's really important to understand the difference between the modifiable versus the non-modifiable risk factors. Obviously, the non-modifiable risk factors are things that our patients cannot change, such as age, their gender, family history of premature cardiovascular disease. So specifically, the older you are, the higher your risk is for ischemic heart disease. As well as if you're a male, you're going to be more risk than female patients. Now, the modifiable risk factors are things that we hope patients can change or improve. And most of these things have to do with lifestyle. Think about hypertension, hyperlipidemia, smoking history, diabetes, obesity, overall a sedentary lifestyle. So really important to ask about activity level, diet, and get labs. Now, in terms of what to do now, if we do identify a patient with high risk for ischemic heart disease, many times there are prophylactic drug therapies that our patients can be started on. And this would include things like aspirin, the statins, the beta blockers, ACE inhibitors, and ARBs. Now, if they are not tolerant, to statins, there are a drug class called PCSK9 inhibitors that also try to lower cholesterol. For high-risk ischemic heart disease patients, the common drugs are helping to prevent cardiovascular events like an MI or heart attack because we're trying to manage their cholesterol levels, their blood pressure, and their platelet aggregation. Sometimes these drugs can be prescribed as polypills for combinations so that we can reduce the amount of medications the patient is getting. And so we might combine some of these treatments. Now, it's important, though, that we individualize this treatment plan. And we determine this by talking with the healthcare team. We're basing it on the individual risk factors and the individual medical history. And the dosages will be catered to the patient's history and risk factors and can be modified or adjusted in terms of, do they have side effects? Is this the right dose? Do they need more or less? Or do they need a different combination? I think one of the hardest things with our high-risk patients is to talk about lifestyle changes in terms of how we can incorporate these things in addition to their medication regimen. I'll see you on the next video. We'll talk more about cardiovascular disease.